Wonderful job. Now it's time for a grown folks conversation. You all ready for that? I think you are. I do. So let's chat. Let's talk about modifiers 59, 51, and 50 because many confuse these modifiers. So I created this little chart that distinguishes them. Modifier 59 is distinct. It means distinct or different procedure. It also means different body part. And go to Appendix A. The full definition is there. And when you get to Part 3, we'll explain these modifiers even more. Modifier 51 for multiple procedures in the same body system. And I think you all nailed bilateral. That means the exact same procedure on both or opposite sides of the body. Is that clear? How does that sound? So is that, I think that's clear. All right, so let's go ahead and I want you to answer the question, which modifier applies? All right, so we have three scenarios, and I need you to tell me which modifier applies. John had a hip replacement on both right and left hips. Which modifier would you use? Go ahead, type your answer in the chat. All right, 100% of you said modifier 50 is appended to the procedure. Outstanding. All right. SC had a biopsy of the jejunum and a biopsy of the duodenum. Go ahead, type your answer in the chat. Outstanding, outstanding. Modifier 51, you append modifier 51 on the second procedure because the same procedure was carried out on the same body area. Both the jejunum and the duodenum are part of the small intestine. Way to go. All right. Jamie had a tonsillectomy and her appendix were both removed. Which modifier would you use? And you can say why too. You all are rocking. I agree. The interns are in the chat, the team is in the chat, and they're saying you all rock. You are AMCI amazing, outstanding, because you're saying 59 on the second procedure because there was either a different procedure and or a different body area. Yeah. All right. Outstanding, outstanding. Now, I started this section talking about grown folks conversation. Just want you to know it's coming. But first, let's talk about this modifier 59. Modifier 59 is one of the most overused modifiers. And this modifier is the most misused modifier, because by virtue of appending modifier 59 on a code, a provider will get 100% of the allowed amount. And just so you know, if you append for certain plans, but generally, and if you append that modifier 51, you get 50%. The subsequent one might get 25%, but it is not 100%. And finally, if you append modifier 50, that second code might get 50%. So that second procedure. But that modifier 59, those procedures that have modifier 59 get paid at 100%. So of course, it is overused. I'm not saying people are unethical. They just may forget. All right, so CMS said, hey, since this is being so overutilized, let's go ahead and implement some alternative modifiers to use in lieu of modifier 59. So you have a modifier XE, XP, XS, and XU. You're supposed to use these four modifiers in lieu of modifier 59. Let me define them for you be a little more specific. When a service is distinct because it occurred during a separate encounter, you append modifier XE. So what does that mean? That means that maybe a patient or the doctor saw a patient twice in one day. Yes, instead of using modifier 59, use modifier XE. When you have a separate practitioner carrying out a service in the same setting, use modifier XP. In other words, that XP modifier will say that a service is distinct because it was performed by a different practitioner. For instance, an example is if this patient saw two doctors during one encounter. Let's say a patient had a suspicious lesion at the dermatologist's office, and let's say the dermatologist said, hey, this might look cancerous, and he calls in another doctor within the practice that has a subspecialty in oncology, and this doctor works up the patient as well, then that patient can be classified as having two encounters in one setting. The one encounter, two practitioners, and that XP will enable both doctors to get paid. And also, it's more specific than modifier 59. And modifier XS says this is a separate structure, meaning a service that's distinct because it was performed on a separate organ or structure. So if you have different body systems, use modifier XS. You're encouraged to. And finally, this modifier XU, this is used for unusual, non-overlapping service. The use of a service that is distinct because it does not overlap usual components of the main service. OMG, what are you talking about, Mrs. J? I'm saying this. If you have to use modifier XU, you are saying typically this surgery would overlap, meaning they bundle one another. Something is bundled into the other. Or they're the same service. They're carrying out the same service, and you wouldn't code for them both. But in this case, it does not. So typically this surgery overlaps, but in this case it does not. And when you pin that modifier XU, it tells that story. All right. I'm going to let that marinate for a second because we do have to go. But I have a story. And I wanted, and this is a story about modifier XU. And it's components of this story are true. All right, so meet Sophie. Sophie was born with a rare condition called uterine didelphys. This means that she has two separate uterus. She's got two separate cervix, and she has two separate vaginas. Now, this is a rare condition and it may affect every 1 to 5,000 women. But despite this rare condition, Sophie never let it hold her back, and she decided she was going to live her life to the fullest. And one day, Sophie found out that she was pregnant. And it was a shock to her because she had been using birth control, but it failed her. So Sophie scurried on over to the doctor and she said, "Hey, I'm pregnant." And the doctor says, "Well, we better get an ultrasound right away because of your rare condition." So the obstetrician carries out the ultrasound and she confirms two fetuses. And the fetus were not in the same uterus. They were in separate uteruses. And there's more. Oh, yeah, there's more. In the left uterus, the fetus was determined to be 11 weeks. And in the right, the fetus was 23 weeks. So that means that Sophie's babies were conceived almost 3 months apart. And what's worse, Sophie will have to give birth twice in 3 months. I'm going to let that marinate. Well, Sophie goes home and she is so just mind blown. She's like, "Oh my goodness, I'm going to have two babies and I'm going to deliver them 3 months apart." And then she remembered, she said, "Oh my God." She thought of something even worse. She said the infant had to have been conceived by two different men. Her boyfriend is in the military, and that 11-week fetus could not possibly be his because he's overseas. But her side man, he's definitely the father. And you know what? Sophie's got some explaining to do. But needless to say, Sophie was overwhelmed with emotion. She didn't know how to handle the situation, but ultimately she knew it would be a challenge and she was determined to face it head on. So she decided to keep the babies and go through with the pregnancy. And Sophie delivered two healthy baby boys. The first baby was delivered vaginally in July, and the second was born vaginally in October. And after those babies were born, Sophie's uterus prolapsed, and she's going to need to have a hysterectomy. Now, this is where the coders have to do their job. Now, let's bring it on back home. Let's code Sophie's hysterectomies. A woman with didelphys presents to the OR for a vaginal hysterectomy, 200-gram uterus, and a total abdominal hysterectomy. Code the encounter. Now, what? No computer system would allow a coder to code two types of hysterectomies in one encounter because they are typically mutually exclusive. However, when a patient has a rare congenital anomaly like Sophie, this surgery would be permitted. So how do we tell the system that these two procedures are not overlapping? How do we tell the system that although this is unusual, this is not overlapping? This is how we would do it. We would code the vaginal hysterectomy, and we would also code the total abdominal hysterectomy. We would sequence the total abdominal hysterectomy first because it's more complex. There was an incision, and then we would sequence the vaginal. And after that, we would append modifier XU because you use this modifier to let the system and the payers know that this is an unusual, non-overlapping service that is distinct because it does not overlap, right? That these two are medically necessary. And we would append that modifier XU. So this is an example of how you would use modifier XU in lieu of modifier 59. If you appended modifier 59, that system would have kicked it out so fast and said, you can't code two hysterectomies. You only have one uterus. Not Sophie. All right, so some people say, hey, I want to know what happened to the husband, the boyfriend, the babies. What happened? I don't know what happened, but I do know that this is a medical coding class, and I got another teachable moment. Yeah. My question is, are Sophie's babies twins? Go ahead, type the answer in the chat. And we have to use the medical, think medically. Are Sophie's babies twins? And people, overwhelmingly, you all said no. Interesting. Anybody think yes? Okay, I got one person say, hey, they are. And here's the definition of a twin. Medical definition of a twin. One of two offspring produced in the same pregnancy. Absolutely. These babies were produced in the same pregnancy, and they are indeed twins. All right, so I think this was an amazing class. I saw a lot of you have aha moments, and I am incredibly proud of you. Keep going. And I just want to summarize things and close us out, if that's okay, because I know we're late. We reviewed the following: HICPICS Level 2 coding. We reviewed modifiers. We practiced coding some modifiers, and hopefully we brought you one step closer to coding mastery. And we want to thank you for being an amazing class. All right, Miss Tamika, take it away.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all